I'm so glad you've joined us today at the Dementia Resource Expo. I'm Renee Horn, Caregiver Support Coach with Elder Options. The University of Florida Smart Driver Rehab Program provides driver rehabilitation services for clients in the greater Gainesville area and throughout North Central Florida. Smart Driver is led by an experienced team of driver rehabilitation scientists and specialists. This program is affiliated with the University of Florida and directed by leading researchers in the field. Clients receive cutting-edge interventions to help them with their driving challenges. The combination of dynamic researchers and experienced clinicians makes the University of Florida's Smart Driver Rehab Program unique in its ability to design the optimal assessment and intervention plan for clients who may be at risk, but who want to continue to drive. Today, Mary Jagers will present on the services that Smart Driver offers. Mary is a practicing occupational therapist and driving rehabilitation specialist. She obtained her Master's of Occupational Therapy from Columbia University in 2016, and in 2019 finished University of Florida's Post-Professional Driver Rehab Therapy Program. Additionally, Mary is a doctoral student in the Rehabilitation Science Program at the University of Florida. Mary's interest lies in community mobility, prevention programs, and healthy aging throughout the lifespan. Before we begin, I want to remind you that you can ask a question or make a comment using the comment section. Keep an eye out for a response to your question or comment. Thank you for being with us today, Mary. I'm going to turn it over to you.
Thank you. Okay, thank you all for joining me. So as mentioned, my name is Mary Jagers and I am a driver rehabilitation specialist at the University of Florida Smart Driver Rehab. And today I am here to talk with you all about Smart Driver Rehab services and what we can offer to clients out in the community. So the Department of Occupational Therapy at the University of Florida has provided driver rehab services since 2002, and previously it was known as Independence Drive or iDrive. So from 2002 to 2016, iDrive performed driver rehab services to over 5,000 clients in the form of direct evaluation and intervention services. And they also participated in a variety of research studies. iDrive then was rebranded in 2017 to Smart Driver, and this was partially because of the evolution of the vision for rehab services, the clinicians who were providing the services, and then a location in the clinic had changed. The overall objective for Smart Driver is to help facilitate safe mobility among drivers in the greater Gainesville area, and that has actually expanded now. We do see clients we've had South Georgia and South Florida, so all over the state are coming to work with us at our clinic. And we know that driving is a complex skill that can be affected by illness, by injury, or potentially aging processes. And what we want to do is to provide assessment and interventions for clients with their driving. So here on the slide, we have one of our flyers, and it highlights the product or the services that we provide for individuals. The individuals that we typically work with, the services that we specifically provide our assessment and interventions, our location of our clinic, and then the price of our driving evaluation. So at Smart Driver, we have two vehicles. We have on your left the 2020 Toyota Corolla, and then on your right the 2019 Toyota Camry. And I actually will go into more detail specifically about the Toyota Corolla in a few slides, because that's primarily the vehicle that we use with clients that come and work with us at Smart Driver. Our team consists of our program director, who is Dr. Sherilyn Clausen, and she is also the chair of the Department of Occupational Therapy at the University of Florida. I am one of the driver rehabilitation specialists on the team, and then we have another driver rehabilitation specialist, Dr. James Worsel. He is also a practicing occupational therapist and a driver rehabilitation specialist, and he obtained his master's in science in occupational therapy from Spring Hill College in 2013. And then he went on to do a post-professional clinical doctorate in occupational therapy with focus on administration and practice management from the Rocky Mountain University of Health Professions, and he completed that in 2017. He also holds a certification as a brain injury specialist, and he was also in the cohort with me for the University of Florida's post-professional driver rehabilitation therapy program that we graduated in or finished the program in 2019. He also is a doctoral student in the rehabilitation science program at the University of Florida, and his interests lie in transitional training for veterans, neurological rehabilitation, and using emerging technologies such as automated vehicles. Our certified driver rehabilitation specialist and consultant is Dr. Miriam Monahan, and she was actually one of the individuals who is heavily involved with our training, and we continually are reaching out to her with questions and help if needed with some of our clientele. And then our wonderful administrative specialist is Miss Betsy Westra. So she would be the individual that clients will typically speak to on the phone and arrange appointments with us, and then works one-on-one with physicians and other clinics or community members that, to get people set up to come to clinic with us. So the clients that we provide services to are those who are medically at-risk drivers through the lifespan. Here is a list of some individuals or conditions that we work with. So we do see people who have neurodegenerative disorders, so this could be something like Parkinson's. A large base of our clientele is older adults, so this could be an individual with some age-related declines. We also see individuals with brain injuries, or maybe someone who has a physical disability such as an amputation or a high-functioning spinal cord injury. All of the individuals that we do see need to be licensed or have a permit. We do see individuals who have had their license revoked or suspended, and we work with those individuals to get one-day permits to work with us. So part of what we do at Smart Driver, as I mentioned before, is a comprehensive driving evaluation. And what that is it's actually a two-part evaluation. The first part of the evaluation encompasses obtaining the client's driving history. And so what we also want to know is the client's socio-demographics and their medical history and how this relates to driving. We do ask that individuals, if they can, complete something called the Fitness to Drive screening measure, and that is a proxy rater, so a family member or friend rating the individual we're working with to help assess their driving fitness. We also gather the information about the client's vehicle and what kind of car they drive, where they typically drive, what times of day, their driving history, if they've had any citations or crashes in the past 5 years. And so the clinical assessment's not only just gathering this information from individuals, but we also want to test their function with motor capacity, sensory, cognition, visual, and visual perception functions. And all of those areas are areas that really underline and impact an individual's ability to drive and their driving fitness. The second portion of the comprehensive driving evaluation is behind the wheel, and this is where we actually take the client on the road and assess them in a variety of different aspects of driving in a certain environment. So to do this, we use a 2020 Toyota Corolla, as mentioned before. We have an auxiliary brake pedal that's on the passenger side of the vehicle, and so that allows the DRSs who are in the car with the individual to have some control if needed. So if we need to use it, we will. If we don't, then we don't. The vehicle is also equipped with 5 different advanced driver assistance systems. And then we also have IVIS systems, which are called in-vehicle information systems. So some of these might be things such as adaptive cruise control, brake assist or lane keeping assist. We have a backup camera, and some of these systems are in many individuals' cars as they are today on the market. Some individuals don't use them and prefer not to use them, but we like to be able to offer them if people do want them, or if we feel that it might be something that someone might benefit from. So we have developed a standardized road course, and this road course consists of about 45 to 60 minutes, depending on what the traffic conditions are, client speeds, and if we need to talk with the client while we're doing the course. So sometimes we'll have to stop, park, and go over some sort of education to work on a specific skill while we're in the car with the client. So this road does span about 17 miles through a variety of different areas in Gainesville. We do complexity from parking lots to residential areas going onto highway roads. And so we test individuals and we want to see them in a variety of different environments, so that way we can know exactly what skills we need to work on, if so, and kind of where to go from that point forward. So we must be able to consider driving history here for our clients, and maybe this means that somebody drives from their home to their church, and maybe they're not appropriate to be driving on the highway. So this is what we want to see on the road course, because this does help us kind of make recommendations for the clients that we're working with, because maybe they would be suitable to be driving with what we would call restrictions, and I'll talk about that a little bit later. But maybe they're also independent to be able to drive in all different types of driving environments. And that's partially what we do, is working with the client. We try to work with what their goals are for driving too, and start at that point of what their goal is, where they're currently at, and how can we try to achieve that goal if that's feasible. So part of our evaluation, again, at the end then, is making recommendations. So based off of the clinical evaluation and the on-road evaluation, the clinician will then try to make a recommendation to the driver. And I like to tell people this kind of goes on a spectrum. So we could have an individual who comes and works with us, and we would recommend that they pass and continue to drive. That we don't foresee at that point when seeing them that they have any skills that they need to work on specifically with us. We may recommend that they pass with recommendations. So this might be that the client that we're working with is okay and independent to drive with certain skills that they demonstrate, but maybe needs to have some skill refinement and enhance skills in certain areas. And in order to do that, we would recommend that they come back and do trainings with us in order to be able to kind of show competency in that skill. And then they eventually, after that, would be able to get a recommendation to drive independently. Some individuals do essentially fail the on-road or the clinical assessment with us, and usually what that looks like with our recommendations is that we would recommend that someone retire from driving at that point. There is also someone who could potentially fail unless there are certain recommendations that are being followed. And for example, this might be someone who maybe is just not able to handle very high complex areas like very busy roadways, highways, maybe unknown areas, but they are able to drive from their home to their church that's 1.5 miles down the road in a rural area. So we do try to consider, what is the client's goals and what's feasible for their life, and what is their surrounding area that they would be driving in. And we try to incorporate that into our recommendations too. So some of the strategies that we use with people who come and see us, so we, as I mentioned before, can do training sessions with individuals to try to refresh certain driving skills that we're looking at. Maybe it's something that we need to help remediate to help mitigate certain impacts from a certain medical condition or diagnosis. And maybe this is something that someone has lost a function. For instance, if someone has had a stroke and has lost the ability to drive or use their right arm or their right leg, using adaptive equipment and vehicle modification strategies can help that individual still stay independent on the road, but using other modalities and modifications to be able to do that if they can't, say, use one portion. We may want to use advanced driver assistance systems or in-vehicle technologies, and maybe that is someone who has, say, arthritis in their joints and has difficulty turning their neck to be able to look behind the vehicle when backing up. And this is maybe something we would recommend and teach someone to use a backup camera to assist with that. It might be something environmental that we're looking at. So potentially we work with individuals to develop new driving routes to help decrease road complexity and make a road more simple for them so that they are able to stay independent. Sometimes we get individuals that we really feel that they need to have a referral to a different healthcare specialist, and that's another strategy or recommendation we would make for individuals. And particularly with individuals who we do recommend they retire from driving, and even some who may not be at that point yet, but could potentially see a foreseeable future with retire from driving, we start to work in use of alternative transportation and a community mobility plan. And Florida has a variety of different resources to be able to help individuals still access their community, even if they're not personally driving. And so this slide actually highlights the Florida's Guide to Safe Mobility for Life, which is the website listed on the slide, provides a variety of information for caregivers, healthcare professionals, other professionals who are working with individuals who are at that point where they need to consider alternative ways to get around the community, and even including companies to call to help with ride setup and in a variety of different ways to help. We also at Smart Driver do have a driving simulator. So behind the wheel training may not be feasible for all the clients that we see. So we do have a driving simulator that we may use initially with an individual until we feel that they are fit to go on road. So we have a full cab driving simulator. The car does not move. It is located in the Smart House, which is where Smart Driver is located. It has a highly functional brake, accelerator, and a steering wheel that is relative to real-world driving. And so there are 7 active screens that essentially create a semi-immersive driving environment. And they have projections on the screens providing a 180-degree field of view that are proximal to the vehicle. There is a projection screen that displays the rear of the vehicle, so traffic conditions behind the individual driving, and then there's 2 additional screens on the side mirrors that essentially simulate what you would see on your side mirrors when driving. So the driving simulator that we use has driving scenarios that come from Real-Time Technologies, Inc. And this is one of the well and highly regarded driving scenario companies within the driving simulator industry. And so one of the cool things is that we can actually customize driving scenarios if needed. I mentioned previously that one of the recommendations that we make may be for doing behind the wheel training with individuals. So after a comprehensive driving evaluation, we do make these recommendations. The trainings may be conducted in the driving simulator if the on-road seems to be too complex for the individual at that specific time. We can do a remediation of skills on road, maybe needed for someone who hasn't driven in a while, or maybe needs to just refresh one of the skills in a safe environment that's not on road yet. So for those clients who do need to have some sort of vehicle modification, we always recommend on-road training with us with this specific equipment. So this could be something such as hand controls, or an adaptation to the steering wheel, what we would call a spinner knob. And so there are a variety of different adaptive equipment and technologies for individuals to be able to train and use in a vehicle, depending on what the deficit is for that individual, to try to keep them independent in driving as long as possible. So physicians are one of the key stakeholders in our process, and therefore if you feel that you have a client or a family member or friend that does need to have a driving evaluation, we always ask that you either work with that individual or that family to be able to talk with their physician to see what the possibility of getting a driver evaluation is, because what we need is we do need to have a referral from the physician. So before the individual comes and prior to that referral is that the physician would essentially identify clients that they feel need to have a driving evaluation. So maybe this is something that they've had a medical status change or something that would impact their driving. And then it's the responsibility of the physician to be able to explain to that individual or that client what the purpose of doing a driving evaluation would be, and then to write a script or a referral to us and fax it to Smart Driver. And then once we get that, we will actually reach out to the individual that was referred to get them set up for an evaluation with us. And then after the evaluation, the DRS or the clinician who's working with the individual will write up an entire report of the evaluation, including all of the background information that was talked about, the clinical assessments, and then the on-road evaluation and what the recommendations would be. So this will be sent to the individual who we worked with and also the referring physician. So it is up to the physician to be able to go over that with their client. So we do like that we have a confirmation of receipt of report, and then being able for them to share those results and talk about it and have a discussion with their client in regards to what the recommendations were and what they feel the client should do at that point. If the physician feels that they need to follow up in regards to the evaluation, they can either contact us, but if they feel that the individual really should not be driving anymore, it's time for them to retire, they can also file a medical report with the Florida Department of Highway Safety and Motor Vehicles. If not, then maybe it's an individual too that just feels, you know, we wanted this as a confirmation, and talking with their physician, they feel that they're willing to give it up also themselves. So if it comes down to it where an individual needed or a physician needed to fill out a medical referral form, this is what the form looks like, and it can be accessed at the following website. And before I had mentioned that there are a variety of different resources out there to help with individuals access their community and to understand driving safety and community mobility. So the Florida Department of Transportation Safe Mobility for Life Coalition has really great resources. It's a nationally recognized, essentially they have a nationally recognized guide for physicians that can be found here that provides information about the responsibilities for healthcare professionals and how it would relate to patients driving. The National Highway Traffic Safety Administration has a variety of different reports and publications that talk about older adults with driving. The American Occupational Therapy Association has an initiative for older drivers. They actually have on their website a database or a connection to a database that you can work with finding a driver rehabilitation specialist in your client's area, because they are throughout the United States and throughout Florida. So maybe there's one closer to a client that you're working with, or a family member, or someone that you're concerned about that you feel they need an evaluation. The Association for Driver Rehabilitation Specialists, or what we would call ADED, provides information on the role of driver rehabilitation specialists and provides contact information for driver rehabilitation specialists in the person's area. We had mentioned again the fitness to drive screening measure, and so that is a it's conducted basically by a proxy rater, so a family member or a friend for an individual that they are concerned about, and it asks a variety of questions in regards to their driving abilities, and then outputs a score to inform the individual of what their fitness is at that point, and maybe that they need to consider getting an evaluation done, or maybe they're an accomplished driver and they're driving okay. So it's just used as a screening measure to help inform people and to help with decision making. And then again, we have some information on UF Smart Driver Rehab. So we are one of the rehab facilities in Northern Florida, and so we provided our information here on this slide also. If you do have any information about our clinic or further questions, you can find our website on the slide here and our phone number. We are happy to answer any questions. If you know, it is a process, and so a lot of people even will call just to understand what we do, and we're always happy to talk with individuals about that. And I appreciate your time today and the opportunity to be able to present to you all about Smart Driver Rehab and working with individuals in the community to be able to drive as long as possible, but also in a safe manner. And that's really our goal at Smart Drivers, just to keep the individual safe on the road, both them and other road users too. So we look forward to the questions that you all have and our discussion to come. Thank you very much.
Thank you so much. Thank you so much.
Yes, of course.
Appreciate it.
Do you want me to stop my share?
Yes, please.
Okay.
So, wow, there was so much information in there. What a great resource. I work with caregivers of people with dementia every day. It's my job, so that's kind of my niche of where I'm hearing about questions for people driving on the road. This is such a great resource for anyone needing this service. Let me ask you a question. How do you work with those who can drive but with dementia? So how are you testing to understand if they can handle unexpected things that come up in driving? And then how do you continue to assess them, since this is a progressive disease?
Right. Wonderful question. Thank you. And let me kind of give a little bit more information too about how we test, specifically too in regards to cognitive declines and specific diagnoses such as dementia. So I mentioned before that we do primarily, a large component of our clients that we see are older adults. So they do come to us with either age-related declines or a specific diagnosis related to cognition, such as dementia. And so what we do is, with our clinical assessments that we choose to use before we go on road, so this would have been in the first part of the evaluation that we're doing, we specifically use these assessments because they have been used in research and they have been determined as valid assessments. And we look at certain scores that are backed by evidence-based and by research to be able to understand, an older adult, or maybe specifically an individual with dementia, depending on what the specific assessment is that we're using, what score should we be looking at in terms of what has been seen as most predictive for on-road performance? And as a clinician, that's really important for me to have that information, especially having it be research-based and having some sort of evidence base to it. And knowing, you know, before I get in a vehicle with someone, what score should I even be looking for? And so that's something that we look for specifically for certain scores, or in our world, we call it cutoff scores. That we look for individuals in order to take them on the road. And that gives us some insight to, okay, when we're doing clinical assessments, we're looking functionally at how people are doing it. So we're looking at how many cues, verbal cues, do I have to give to an individual to complete one of the assessments? Do I need to continue to repeat the directions? Are they getting frustrated? Are they getting stuck on a certain area? All of these somewhat observations and ways that I would assess someone while they're doing these assessments gives me information too of what I'm going to have to do on road with them and kind of what to anticipate. So that's from the clinical side of things, of how we would specifically look for it, specifically with a cognition diagnosis or a diagnosis such as dementia. We look at specific criteria, essentially, to look at that. And then on road, we also include components that essentially test someone at a higher level component. So again, I mentioned we take them in a variety of different environments. So we go from residential to suburban to highway driving, and then come back, and we actually go by campus. So we do put people through some areas that are very highly complex. And then on top of that, we add in components to our on-road evaluation, such as navigational tasks. And if you think about, you know, with dementia, having that high, complex, busy traffic environment, plus I want you to find me a gas station and get me there, or I want you to find me a food joint that's on the left-hand side after you had just turned right, all of that is adding to that cognitive workload for the individual. And so that's something we assess, but that's very needed for driving in high traffic environments and highly complex dynamic environments. So we want to be able that, you know, to ensure that an individual can be able to handle that. And maybe that if they can't, then maybe that just impacts our recommendations at that point. So on road, we try to incorporate these extra strategies to essentially challenge the individual, and specifically in skills that we know may be impacted with a diagnosis such as dementia. I also think too that when we're working with a client specifically, such as an individual who may have been diagnosed with dementia, really working with the family and having that support, you know, because we can give recommendations and try to explain something, but at that point they may not be able to fully comprehend what is going on and what we're explaining. So having some sort of social support from that individual, either a family member or a friend, is very helpful for us. So if we're working with someone, you know, if someone's there and has their spouse or their cousin, whoever it is that had come with them to the appointment, I always ask the individual, can we bring them back into the room when we talk about recommendations? Again, it's up to them. But I do feel that if a family member's there, it's easier for, you know, the support of them to understand this is what we did. And then it's not just relying on the client to fully understand everything we did and then relay it to who they need to. Because it is about a 4-hour session, essentially, if we did the clinical testing and the on-road testing. And so it's very, sorry, what was that?
Then they can be reassessed later?
They can be reassessed, yes.
Okay.
Yeah, and so sometimes we don't even get through all of it. We only get through the clinical portion, and then we make a recommendation, you know, go work on certain skills or follow up with this referral for a health professional, you know, specialty. So yes, it just varies per person. But our goal is to help people remain independent. And if they can't, then we try to help them be able to stay active in the community in some way or another. And so that's where, you know, the support of others is really important too. And particularly with this diagnosis, what's very difficult is that when we give recommendations, say if someone had some sort of deficits in some of the skills that we were looking at, they may show that in the clinical aspect, but on the road, they may not show that. And part of that is because, you know, if it's an older individual that we're working with, an older adult, they've been driving on the road for so many years at that point, and that they're going from their home to the church or to the grocery store probably multiple times a week. So it becomes this rote activity to them. The problem comes is when they get into an environment where something happens unpredictable and it becomes too overwhelming for them cognitively. And that's where we have actually seen individuals make some serious errors that could be somewhat catastrophic or fatal for people. So we try to be very careful with these recommendations, specifically with diagnoses such as dementia or other cognitive diagnoses, because, you know, it's as you said, it is progressive, and it's definitely something that we don't want to take lightly, but we also want to think about the future. And so that's something too, when we talk with individuals, maybe they see us there, they work with us for a few training sessions, and we feel, okay, you know, you should be independent to drive in your local areas, essentially. And again, we're just making recommendations to them. But I always tell people, you do have a progressive disease, and so it is important to continue to monitor that. So continue to talk with your physician, continue to have family and friends really give you some feedback on your driving, and partially you could use the fitness to drive screening measure for that. So you're continually assessing yourself and your driving abilities. And then if you need to come back for reevaluation or an evaluation at a different point, maybe a year down the road, then you can do that.
Yeah.
But always continually to kind of think about that, because things will change.
Yeah, thank you so much. And I love that you have resources for after, like if they have to discontinue driving. I love that you use the word retire from driving.
Yeah.
But I do appreciate that you have some resources. You're not just saying you're done driving. You're then saying, and here is some things you can do. Please know, I'm talking to the audience now, that you can continue to ask questions in the comments field. But I do want to thank you for sharing with us today, Mary, and thanks for joining us today at the Dementia Resource Expo. We really appreciate it.
Yeah, of course. I actually just wanted to make one more comment, if I could, that you brought up just this last little part. And I want to make sure to, you know, working with clients with dementia, I always try to tell people it's not something against your intelligence or your person, you as a person. It's something against what you have as a diagnosis. And that's something out of your control at that point. And so that's something I always try to relay to my clients that I'm working with, is that this is just something that has come up and it's happened, and we're going to have to deal with it. And it's not anything against who you are as a person. You are probably a great person, and you are very smart. So I always try to clear that up with them too.
Yeah, I think that's great advice. So those of you out here watching this, keep that in mind. I love their message. So thank you again, Mary.
Of course.